litigation? Litigation. We have about 17,000 pressure injury suits every year. About 17,000 pressure injury suits every year. 87% of the time, the case favors the patient or family. 87% favor the patient or family. Second only to wrongful death. Second only to wrongful death is pressure injury litigation. Average settlement is $250,000. We had one in Texas that was $312 million. $312 million. Now, the Office of Inspector General, the OIG, they have some information related to resident safety and harm issues. The survey process, I want you to think F314. The surveyors are instructed to review your QAA processes. Now there's some things, and when I say that, maybe not necessarily what's in your QA process, maybe not what's going on, but you know, according to the survey, you have to have someone who's the head of the QA, you have to have your members that are in the QA. All of this has to be put in place. I'm sure every building has this, right? You have your QA process. It is required. It is mandated, federally mandated. Then you're looking at the impact of facility performance. So quality measures are something that's going to be tracked more and more and more for pressure injuries. And CMS gathers this data on the percentage of data of patients who develop pressure ulcers in your facility. And there is a, yeah, that's it, that get their pressure injuries. And you can look at this overall rating on your nursing home compare. Now, this comes from, this is a document that came out of the Inspector General's documentation, and it talks about temporary harm events, and go down to this level right here, events related to resident care. The number one is pressure injuries, is pressure ulcers. Pressure ulcers. Do you know a facility that's ever gotten a IJ from a pressure injury? Yeah, absolutely. In 2016, July, this month, 2016, I'm going to give you the 10 most common F tags. You're going to get the 10 most common F tags. Infection control. How many of you think a lot of those are related to dressing change techniques? They are related to dressing change techniques. The surveyor following you and watching you do dressing changes. Number two, most commonly cited tag is pressure ulcers. Number two. This is brand new information. I got it 3 days ago. Number three, abuse. 4, accident prevention. Sanitary kitchen. F309, quality of care, which is pain. Pain is in F309. Quality of care, pharmaceutical services, unnecessary medications, incontinence, which also can lead to and contribute to pressure ulcer or other skin issues, top-down type issues, moisture-associated skin damage. And number 10, services performed by qualified personnel. Now, what qualified means, I don't exactly understand if it's a licensure deal or a training and competency deal. Is it licensure or training and competency? Training and competency. Oh, for not having their in-service and so forth and so on. Okay. For the aides alone.